her time with Dr. Wang and some of the residents who are on his rotation made in her life, and how she's been successful because of something Dr. Wang and UVA Ortho had done for her. But I was going to let Dr. Chopper say a few things about Dr. Wang.
Yeah, just before we hear from Ms. Modly, and I'm very excited about hearing this talk because I've heard about her for many, many years. To meet her in person is really special. So Dr. Wang has been, and Amy Wang have been a core of the Charlottesville community for decades, I think since the 70s. And they are sold their house and they're leaving Charlottesville and spending time in Taiwan and with the grandkids in New York and California in the future. So we're not going to see him in Charlottesville like we've seen him every year. And this, I think this is the last alumni conference that he may attend. So I know all of you who have trained under Dr. Wang and have been mentored by Dr. Wang know how important of a person and how a great teacher and mentor he has been. This department would be nowhere if it wasn't for Dr. Wang and what he did to advance our program. And we are where we are today because of Dr. Wang. And he's been a dear friend to so many of us. And he truly is a remarkable surgeon, remarkable teacher, remarkable mentor. And he is an incredibly loyal person, him and Amy, to the Department of Orthopedics. And we cannot express how grateful and thankful we are to everything you've done for us here. And we will continue to share your contributions with the future residents of this program, because as I've said, we stand on the shoulders of giants, and you are the biggest giant for UVA orthopedics. And we hope our paths continue to cross, maybe not in Charlottesville, but maybe we'll all visit you in Taiwan for a UVA orthopedic alumni meeting. So thank you, Dr. Wang, for everything.
So I'll invite Robyn Modly up. Robyn's from Fredericksburg, Virginia. She had some knee pain back in the 1980, and she was seen by an outside physician who referred her to Dr. Wang, and the rest is history. She now lives in Florida with her family. And thank you so much for coming up here from Florida. This is how important it was to her to come and sort of give her thanks to you, Dr. Wang, to the department. So thank you, Robyn, for being here. Just click
Show me.
Just the down button.
Okay. I just want to reiterate what an absolute privilege it is to be here today. I say this with the utmost sincerity. I do not take it for granted that I'm actually standing here after what I've been through and what you're about to see. There's a saying.
That's the bottom button.
That's what I'm doing. There's a saying, there but for the grace of God go I. This I wholeheartedly believe, but lightheartedly, I say, there but for the genius of Dr. Wang go I. I'm not equating Dr. Wang with God, but I always acknowledge Dr. Wang when speaking to anyone about my knee, especially other orthopedic surgeons. The truth is, without fail, they remind me that I am walking on this 44-year-old knee because of the surgeon that placed it there. For this reason, I am absolutely delighted to finally be here in person to give you, Dr. Wang, my very own standing ovation. I know you are a humble man, but please accept my public expression of appreciation for the risk you took and gratitude for this successful outcome. Thank you. I felt it was also important to acknowledge another legend, the late Dr. Warren Stamp, who was chairman of the department at that time. Dr. Stamp successfully trained Dr. Wang and fostered an outstanding academic and research environment while bolstering the reputation of this institution. I also want to applaud you, orthopedic surgeons who have devoted your career to research and repair the musculoskeletal structure of the human body. Not one body is the same as another. Each case presents a complex set of variables. Some you can control and some you cannot. We all know the cliche, hindsight is 20/20. By looking back on a situation, we can clearly see now what was not unknown at the time. I hope that by telling my story, I can offer you a hindsight perspective on some of the factors that contribute to a positive outcome to the crucial work that you do every day. I want to take you back to the August of 1980, Fredericksburg, Virginia. I was a senior at James Monroe High School. I had been riding horses since I was 5, competing in horse shows since I was 9. I'd been a cheerleader and just made the varsity field hockey team. I was also taking jazz dance lessons at a local studio. By September, I was experiencing pain in my left knee. The pain was strong enough to make it difficult to run the drills and do what was required of the team. By sheer will, I kept running and dancing and riding and working as hard as I could on the field and in the studio, but it was a struggle. Before the first field hockey game, the coach called home to tell my parents that I was lazy and would be released from the team. Discouraged and in pain, I saw a local orthopedic doctor and was diagnosed with a deteriorating cartilage. The doctor ordered a cortisone injection and physical therapy, which I pursued for the next several months. My quadriceps were strong, but my knee was getting weaker. I continued to dance, but my left leg alone could not bear my weight. By December, I was leaning my body against the school lockers to walk down the halls to class. I have no idea why we did not get a second opinion or dig deeper into the cause of the problem. However, what happened next changed everything. On December 27th, 1980, I was at a formal dance of older college-age friends. We danced the first song of the night. In the middle of the pretzel, my knee collapsed and I went down. I didn't know it was fractured. I just assumed it was more of the same pain I had been experiencing already. So I sat at the table with friends for the rest of the night and did what everyone else was doing. Drink alcohol and forget your cares. I got home several hours later and went straight to bed. In the middle of the night, I woke up screaming in pain with a knee the size of a grapefruit. We went to the emergency room, but they said it was too swollen to x-ray. Remember, it was 1980. We returned home to ice it and wait for the swelling to go down. Eventually, the image revealed an expansile lesion in the distal femur. Plans were made for further evaluation at what is now University of Virginia Health, the Department of Orthopedic Surgery. My parents rented an apartment over the local pharmacy across the street, and I checked into the Behringer wing. I was assigned to the late Dr. Harold Wanabo in surgical oncology and Dr. Stamp and Dr. Wang in orthopedic surgery. On January 5th, 1981, I had a body CT scan and a whole lung tomogram and a bone scan. On January 7th, I underwent a left leg arteriogram. And on January 9th, I had an open biopsy of the left femur. That's the Behringer wing back in the day. To quote medical records, a preliminary view of my left femur demonstrated a large leg lesion in the medial aspect of the distal femur involving both the epiphysis and the metaphysis. The fracture was noted through the lesion. There was a marked periosteal reaction on the medial aspect of the tumor in the area of the fracture site, as well as the posterior aspect of the lesion where the cortex was also breached. A faint calcification was seen anteriorly behind the patella. The angiogram showed a vascular blush at the margin of the tumor. This blush was also seen posteriorly and anterior to the tumor in the soft tissue. No definite blush was seen within the center of the tumor. The tumor extended back to the area of the popliteal artery, but did not encroach upon or displace it. Lungs were clear. The frozen sections of the biopsy were consistent with a malignant tumor. The permanent pathology was interpreted as a giant cell tumor, grade 3. And I think I remember it being 6 centimeters. I remember the day they came in to tell me that the tumor was malignant. The diagnosis didn't bother me. A 17-year-old feels invincible. I never thought, why me? I honestly felt like, why not me? I had a strong faith in God and an unrealistically positive attitude. The social worker came in to talk with me, and I dismissed her concern and probing questions. I thought there were patients down the hall with much greater challenges and much more negative mental attitudes than I had. I told her she needed to spend her time with them. My hindsight view of that moment, big mistake. In my opinion, anyone in the hospital for more than several weeks and with any kind of life-altering diagnosis needs some degree of therapy. Furthermore, let me be clear. If I had cancer today, I would still have a positive mental attitude, but I would be positively devastated. A 17-year-old does not necessarily realize what they have to lose, but a 62-year-old knows exactly what they have to lose and how their life will be impacted. I was appropriately naive. In mid-January, plans were made for me to return home to Fredericksburg, Virginia for a few weeks while a Gepard prosthesis was made for me. As you probably know, Gepard prosthesis is a solid metal hinge knee replacement introduced in the 70s. It has a rigid hinge mechanism and does not allow for the natural medial rotation of the joint. My understanding is that this particular prosthesis fit the unique needs of my case. They would use it if they could, but they would only be certain once they got in and put eyes on the situation. Dr. Wang will be able to speak to the reasons behind this choice of the prosthesis, as well as a clinical aspect of the surgical procedure. So at the beginning of February, I returned to the hospital. One more scan was performed to assess changes and set expectations. Surgery was set for February 4th, 1981. My brother surprised me and flew in from California. At 11 p.m. on February 3rd, I sent him over to Little John's to pick up my favorite pre-surgery meal, the famous sandwich called 5 Easy Pieces. My surgery was scheduled for the first time slot of the day, but of course it actually began around noon. One of the most encouraging moments of the day came from the OR nurse who was with me before I went in for 6 hours as we waited. I think and feel very strongly that it's important that I honor her memory by telling you this small part of the story. I don't know her name. She was a very large African-American grandmotherly figure who held my hand, one of my hands while I held a small gift book of Psalms in the other hand. When it was my turn to go in, she took the book out of my hand and said, "Now, Miss Robyn, you just keep saying, 'Thank you, Jesus. Thank you, Jesus.'" I'll never forget her soft, round, angelic face. I tried to find her on one of my follow-up visits, but she was gone. I do believe surgeons create the masterpiece, but nurses soften the clay. Dr. Wang can explain the procedure from your point of view. I don't have the operating notes from this procedure. I'll give you show and tell later of my knee if you want. I have shorts on under this dress, so I'm happy to pull my skirt up and show you my incisions, but essentially surgeons open up the back of my knee with an S-shaped incision. I presume the purpose was to get a look at the position of the tumor in relation to the femoral artery and the femoral nerve. Ultimately, a 9-inch incision was made in front of my knee. Surgeons removed my patella, 2 quadriceps, and 2 hamstring muscles. The femur and the tibia were each cemented with a cobalt steel rod, and the center is a hinge joint. Within the day or two of the surgery, I was required to begin physical therapy. Post-op pain mattered less to me than my desire to start moving. During my first session, I had zero ability to move my muscles. There seemed to be no connection between my brain and the nerves that signaled my muscles to contract. Try as I might, as you know, I got no response, no muscle contraction. My legs seemed detached from my body. My 7-year-old's expectations were crushed. Back in my room, I found several chocolate nutrition shakes that accumulated on my tray table. In my frustration, I proceeded to hurl each one of them, one at a time, into the hospital wall in front of me. As the last one splattered, the door cracked open and the pastor from my church asked if he could stop in for an unexpected visit. He drove 90 miles only to find an angry, discouraged teenager who was not interested in a friendly chat. Come on, baby. It's the button. It's the button. Okay. I remained in the hospital and continued therapy for another 2 weeks. I would be released to continue PT at home once I could bend my knee approximately 60-65 degrees. I was released on my 18th birthday, February 20th, 1981. At home, I spent my days with a homeschool teacher and a physical therapist at Mary Washington Hospital. My physical therapist was very interested in my case. He wanted to see me walk again and enthusiastically joined me in the effort. He was a marathon runner and tried to encourage me by writing my name on the runner's number pinned to his back. During those months of rehabilitation, my physical therapist got married. And guess who he married? He married the field hockey coach that kicked me off the team. You can't make that stuff up. Finally, she was forced to understand that I was not lazy after all. To wind this story down, I want to briefly highlight my adult years. More specifically, I want to tell you what I do that has contributed to the longevity of my prosthesis beyond Dr. Wang's great work. I attended the University of Richmond because they offered to give me handicap status and move all of my freshman classes to the first floor of the building. This made it easier for me to get around on crutches between classrooms. Make note that the Americans with Disability Act did not come into law until 1990. So it was a big deal for the school to move my classes to the first floor. I maintained my relationship with Dr. Wang and his team for follow-up visits, but I also maintained my relationship with Dr. Stamp. I had the opportunity to visit him in his own hospital room when he was a patient of orthopedic surgery. It was a very emotional moment for everyone to realize that the roles were reversed and the patient was at the bedside of the doctor. Albeit professional, doctor-patient relationships really do matter. I married my husband in 1988. We lived in Colorado Springs, where he was a professor at the Air Force Academy as an exchange naval officer. I contacted the orthopedic department of the Air Force Academy to monitor my case. This was just 6-7 years after my surgery. So I was continuing to do follow-up there. One of the doctors told me that I should reconsider the idea of having children because running after toddlers would lessen the length of life on my prosthesis. My response to that, I was pregnant within 2 months. Our first daughter was born right there at the Air Force Academy Hospital, in the same place where they told me to reconsider having children. Another thing that's important to note is that I did have 4 cesarean deliveries. No OBGYN doctor wanted to handle the potential challenge of an orthopedic issue. They did not want to deal with my 90-degree bend prosthesis. But I now have 4 grown children and 4 grandchildren. There are some spouses there as well, but I go with those children, but they're not in the picture. While we were growing our family, I earned a master's degree in counseling from the University of Colorado. My initial intent was to go back and counsel young cancer patients like myself. I also earned a master's degree in human development and psychology from the Harvard Graduate School of Education. I spent my professional time working with anxiety and depression and adults and children with ADHD, attention deficit hyperactivity disorder. I ran adult support groups, I counseled families, and I taught a course on parenting ADHD through the lifespan. Unfortunately, I did not go back to riding horses except for the one time just to prove I could that was pictured in that newspaper article. Caring for my children was a priority, and I did not want to take the irresponsible risk of falling and harming my prosthesis. I do continue to exercise. The range of motion on my left knee is actually 112 degrees. I have 100% feeling in my lower extremity. The strength of my ability to maintain a straight leg against opposing pressure is 5 of 5. I can bear all my weight and balance on my left leg. I primarily lift weights, but I also do yoga, Pilates, and bar. I've been able to lift weights without injury by maintaining the brain muscle connection. I have a laser focus on this specific muscle that I'm working in order to avoid carelessly overexerting my prosthesis. I also use TRX bands when I do squats to take the weight off my knee and focus solely on my glutes. My diet has always been high in lean protein, whole grain carbs, and lots of vegetables with deep leafy greens and calcium-rich food, the classic thing that everyone wants you to do, but it's essentially a Mediterranean diet. I do eat gluten-free, and I am lactose intolerant, but there are plenty of dairy products with lactase enzyme added and calcium-enriched plant-based foods like almond milk. Regarding supplements, I take fish oil, vitamin D3 with K, vitamin C, B12, magnesium. For anti-inflammatory purposes, I take the active ingredient in turmeric, which is curcumin, with quercetin and resveratrol, as well as low-dose naltrexone. I also add collagen peptide powder to almond milk. And I can ride a bike. The Townie Beach bike have a seat that is set a slightly bit further than the regular 10 speed, allowing the compromised bend of my knee to adequately push the pedals in motion. When my knee was more fragile in the 80s and early 90s, my husband moved the pedals closer to the chain so that it would be a smaller rotation for my knee to go around. We also had a tandem bike, but now I live at the beach and I ride a beach cruiser. The catch. Even though I eat well and do weight-bearing exercises, I have a constant battle with bone density. My most recent DEXA scan results from March 31st this year revealed osteoporosis in my left femoral neck, and I have osteopenia in my lumbar spine and left hip. The osteopenia is up from osteoporosis because I did the nationally recognized program called OsteoStrong. You may know about it, but I did that for a year and went back and got a DEXA, and it did improve. But I used to take Prolia injections for years, but I stopped them during COVID. And then when I moved to Florida, several doctors discouraged them. I tried to go to a couple of endocrinologists and a rheumatologist, and they said my estrogen therapy was enough, but clearly it's not. I take bioidentical hormone replacement therapy and I get my labs checked every month. I feel great, but my bone density silently disagrees. I did find I have kept my x-rays from 81, the 80s, and most every time I go. The old school x-rays are there, and this is 2023. The 2025s I have, they look good, but I couldn't get them off the digital format for some reason. My computer wouldn't do it. But anyway, you can see that things are well seated. And there's another image of the femur and the tibia. And there's the femur from 82 and 23. It is remarkable. Finally, dancing. Almost done. That is my dance instructor, not my husband. As a reminder, my relationship with Department of Orthopedic Surgery began over 44 years ago after my leg broke while dancing in 1980. Just 3 years ago, my husband and I started taking ballroom dance lessons to prepare for our youngest daughter's wedding. And I really do love it. This is a spontaneous, oh shoot. Can we turn that volume down? It's a recording while I was taking a lesson. It was it's 50 seconds, so bear with me. Lately, I've been dancing 3 days a week for well over an hour at each session. It's been a lot of fun and offers me an enormous sense of freedom. But more than anything, for me, dancing represents victory. And this presentation for me is my victory lap. I really, really appreciate you allowing me to tell my story and take my victory lap in this very important place. I'll close by saying one last thing, and this is going to stop playing any second now. I hope my story offers you a window to the intimate details of the patient experience from a social and emotional perspective. This adds a crucial element to the standard clinical history and contributes to a successful outcome. The patient's mental attitude can sway the outcome one way or another. You may not have time to address it, but you can ensure that it gets attention by someone on your team. And finally, I hope my story illuminates the value of the doctor-patient relationship. You have clearly seen how important it was to me and still is. There is so little time for doctor-patient interaction. However, the quality of that interaction can be a change agent for a successful outcome. You are the finest doctors in the world in one of the finest institutions in the world, and your work matters. More importantly, each one of you matters in your respective roles to literally change a person's life. I close my remarks today with a deeply sincere thank you. That's it.
Please sit down.
I'm going to.
I think you learned one thing at least, one day, today. Wherever you are, the patient will look you up. Okay. I lost follow in around 7-8 years after the surgery. Then I went to Taiwan. In the middle of the night, someday, my email showed her looking for 20-something years after the surgery. So that's something that only physician, the privilege only the physician can have. And before I left here, I'd like to say some grandpa words to all of you, just for the memory. Actually, I'm very pleased here today to catching out with old friends and making new acquaintance. As I look back on over 50 years that I have been orthopedic surgeon, I realize that the patient-doctor relationship has changed. But the profound impact of what we do remains the same. We must keep in mind that even the smallest step in our work can change patients' life. We often perform what might seem like routine surgery, but for our patients, this is a life-changing moment. We often think of ourselves as problem solvers, treating illness and injuries, but the best doctor do more than that. Witnessing a patient's journey, seeing their life improve because of your care, bring a whole new level of meaning to our work. Robyn Modly is the perfect example. At the time of her treatment, her only option were a knee fusion or amputation. Both were unacceptable to her. So we select the Guipa knee, originating from Paris, France, as her treatment choice. At that time, it's the only device that could both bridge the gaps after resection the tumor and also provide the motion of the knee. Initially, I was hoping this could give us some time to wait for a new scientific development that would be her long-term solution. Remarkably exceeding all expectation, the knee has served her well for 44 years and is still going strong. I believe the longevity of her knee replacement is due to 5 main factors. First, Robyn's own hard work and perseverance. Her diligent adherence to rehabilitation has enabled her knee joint to remain functional for so long. Second, although at that time, the design of procedures reported a 15% of a loosening rate and 2% infection rate, this did not manifest in her case. Third, to some extent, the polished surface of the device also improved the longevity of the cement fixation. Fourth, the surgeon's ability to keep the knee well aligned was key to minimizing the wear on the knee. And lastly, luck. When I choose to remove the bumper of her knee at 6 months without replacement, I think this prevents the development of synovitis, joint swelling, and pain. UVA is always at the forefront of orthopedic innovation. The training here is evidence in outstanding results we achieved. It is no wonder UVA has produced such skilled surgeons who are capable of performing groundbreaking surgery and making such impactful improvement on their patient's life. I'm very, very proud to be part of its legacy. Looking ahead, I feel hopeful. We have the tool, the knowledge, the passion, to keep innovating and providing exceptional care. I'm confident that you will continue to build on this strong foundation and provide even better care for future patients. Lastly, my tradition has always been to open up a bottle of cognac upon the completion of the chief residence. So as this will be probably my last time to attending the alumni meeting, I have brought 2 bottles of cognac so that I can toast you a farewell and wish you a prosperous future. Thank you very much.